will detect it in the early stages. You can detect even in cellular stage. So pap smear is nothing but cytological examination. Even in the cellular stage, you can catch the disease. So this is the position. So the woman will be placed like this. Speculum will be gently introduced into her vagina. First, the gynecologist will look into her cervix. She will examine the vaginal walls and then the cervix. The healthiness of the cervix is assessed. Okay, the spinous junction will be seen. Okay, then she will take a smear from the sperma junction with the help of a special wooden spatula. Okay, it will be very soft. It is wooden spatula is placed and the exfoliated cells which are present around the cervix, they will be removed and then they will be smeared over a slide. In addition to spatula, we also use a cytobrush, right? Endocervical cells may be missed sometimes, depending on whether the patient is in which phase, whether she is in age of the patient in perimenopausal or reproductive age group or in pregnancy. Okay, to take the endocervical cells mainly we use the cytobrush. Then these exfoliated cells are smeared onto a slide, and then they are fixed and sent for pathological examination. What pathologist, they then stain the slide. All of the, I think you know about the tissue sections. You have seen cytology, no? So similar to that, they do cytological examination and then interview interpretation. The pathologist will take 1 to 2 days and give the report. So before going into that, for whom pap smear is indicated, we will talk about this. Okay? For Indian settings, the screening can be started right from 21 to 29 years. It should be done every 3 years. If yearly reports are negative, you can repeat every 3 years. Then after 30 years to 65 years, you can do it every 5 years. That is when the smear is negative. Even when the smear is negative, you have to repeat it again. It is a simple OPD procedure. It is 100% painless. So it is very user friendly. And you can do it in a OP basis, and the report comes in 1 to 2 days. Okay? And there is another test, HPV DNA test. If this pap smear is done along with HPV DNA test, you can repeat once in 5 years. So at least once in 3 years, below the age of 30, you should take the pap smear. Then after 30 to 65 years, they should take at least 5 yearly. Okay, if both the tests HPV and pap smear